Now let's talk about trigger points and pain because they have kind of an interesting relationship to the experience of pain. So referral means that you feel pain in one part of your body, but that may be not even closely related to the tender point or where the trigger point is located. Now, here we're showing one in a trigger point in the tensor fasciae lata muscle, which is a very important muscle in sciatic pain and lower body pain. And this muscle is very involved in gait, so very commonly gets disturbed when there are gait disturbances. A person might be a hyperpronator or have a leg length discrepancy, and then the TFL possibly on one side may get tight. Well, the pain you feel from that is kind of over the side of your hip or the greater trochanter area, and then it'll spread down toward the knee. Well, we call that's a sciatic pattern. It doesn't mean anything related to the sciatic nerve. That's just the nature of the pattern is that it kind of extends down the leg. And then often this will get diagnosed as what they might call trochanteric bursitis. What that means is that, they're assuming that you have an inflamed bursa over your greater trochanter bone, which a bursa is just a little sac that's like a cushioning sac. And this is a very common diagnosis. It's considered to be kind of a garbage diagnosis because just because you feel the pain in that area doesn't mean it has anything to do with your bursa. They're not going to cut you open and verify, that the bursa is inflamed. So it's a guess, really. And it's not a very useful one because all that it leads to is, yeah, you should take maybe anti-inflammatories. So people end up taking Advil or Tylenol, and what's the point? It's not helpful. So a lot of the diagnoses that these trigger point pain patterns lead to are very inappropriate and not very helpful. Now, referral confuses most people because it occurs over bones and occurs over tendons. In this case, somebody might say you have IT band pain, and so you might have IT band syndrome. That's another complete garbage diagnosis because the IT band doesn't really do anything. It's just a connective rope, basically, that ties the greater trochanter and the femur, your leg, to these muscles that are able to move them, like the TFL. So the IT band itself doesn't get into trouble. There's nothing really wrong with it. It's not a problem. So what we have to do is separate the experience of the pain from the reason for the pain, and that is not done in the medical system. You might have pain over an organ, and then somebody says, you need to get an internal examination for, an organ issue or an internal medicine issue.